Thank you for tuning in today. We are going to talk about Security Health Plans, Medicare Advantage plans. And I first want to start off by saying thank you for being a member with Security Health Plan. We have some wonderful changes for this year, making the costs more cost effective and the copays smaller. So we will definitely talk about those along with some of the extra perks as well that you continue to enjoy being a Security Health Plan member. As I mentioned, I am very appreciative that you are a member of Security Health Plan, and we are celebrating 50 years. So we're very happy that we're able to have these plans and continue to grow. And of course, you're part of that. It makes it happen for us so that we can continue to share our plans and year after year continue to grow and to go forward. So first, let's look at the plans itself as far as the rating. When we look at different options, we always want to look at how we are graded or rated to make sure we're doing the best we can for you as our member. So the first emblem here is CMS. That's the Centers for Medicare and Medicaid Services. So the government. And we receive a star rating every year from CMS based upon the way that we are providing our care, our coverage, the cost effectiveness of our plans, and of course, member satisfaction. And we received a 4.5 out of a possible 5 stars. And again, we couldn't do that without you and your wonderful feedback and always letting us know ways we can continue to grow as a plan. So that's the first one. Then the middle one is NCQA, which is the National Committee of Quality Assurance. That's also an organization that looks at what we do to make sure that the customer's experience, the prevention and treatment that we offer are always being met. And we also received a 4.5 out of a possible 5 rating from this organization as well. And then the last emblem up here is our customer service. We received 3 quality awards of excellence. And this is such an important piece of who we are at Security Health Plan. We want to make sure when you call in and you have a question, whether it be about a benefit or a claim or a provider, that we can answer those questions for you accurately and as quickly as possible. And another great piece is, of course, we're local. So when you call us, you'll be speaking to someone here in Wisconsin to answer those questions for you. So this is a big part of the plan. And again, we thank you for being involved with this. The next is the member satisfaction rating. So some of you may have partaken in a survey that we had asking different questions about how we can improve and what we're doing right. So we really appreciate your feedback. And these are the things that came back is the coverage that you want, the quality coverage that we provide. Certainly we do that. We offer both in and out of network, of course, coverage. The affordability, we have many different plan options and some having a $0 premium. And then the customer service, as I mentioned earlier, just again, making sure that we're here for you, answering the questions that you have as quickly and accurately as we can. So now let's talk about the plans and the changes. As I mentioned at the beginning, we have some changes to the copayments. We are taking away primary care copayments. So regardless of what Medicare Advantage HMO point of service plan you have 0 copayments now when you see your primary care physician. We've also reduced the prescriptions on some of our Part D plans. The copays are now a little bit less than they were, and then keeping that stable monthly premium. You know, we've had a few little tweaks here and there, but again, year after year, we've kept it very stable. And then the last change is we've unified our plans. We're now available in 55 counties throughout the state of Wisconsin, and that everyone can have the option to have one of these plans. So let's take a look at that. So we've got 4 plan options here within these 55 counties. We have the Esteem RX, which is the $0 premium plan. This is our fastest growing plan. Of course, you still get all the wonderful Medicare benefits, and it could be great for someone who wants that extra coverage if you're going to be out of the country, because of course we do cover worldwide emergency and urgent care services. We also have the Ascend RX plan. That's our $40 plan. Again, more moderately priced. It's an attractive plan that for some people, it fits the bill because you still have a smaller premium. You have, again, 0 copays when you see your primary care provider, and you get all the extra benefits. Then we have our Essence RX plan. Our Essence RX plan is our fastest and also, I should say, most popular plan because with that plan, you do have the option to have with or without prescription Part D, and you still have a moderately priced premium and out-of-pocket maximum. Then we have our Spirit plans. Again, these have the choice of with or without prescription Part D. Might be for someone who's looking for the lowest out-of-pocket. This might be a great fit. All right, so let's look at the premiums. I talked about the stability of our plans, and you'll see with the Esteem plan, it stayed the same year after year, as has the Essence. The $16 plan is now going up to $18. Okay, the Ascend stayed at $40. The Essence RX just went up a few dollars from $85 to $88. The Spirit plan stayed the same. The Spirit RX plan, again, just a few dollars, went up to $229. We do still have our Ally RX plan, which is our dual special needs plan, and that has stayed the same at the $0, along with our Secure Saver MSA plan, has stayed the same at $0. So this is an overview, and hopefully you received this information in the mail as well, and it explains the plan options. Again, it talks about the plans in the first column, the names and the monthly premiums and out-of-pocket maximums. Then it talks about who we typically see those plans are best suited for. And then as you go across each column, you'll see the different benefits. Then find the plan that you're interested in or the plan that you're currently on. You can see what the copays would be. Again, not much change here, except for no longer having the primary care office visit copay. Changes to your prescription drug copays. We have now decreased the copay on tiers 1 and 2 for our Esteem RX plan and the Ascend RX plan and the Essence RX plan. So if you take a peek here, if you look at our tier 1, both, again, the Esteem, the Ascend, and Essence, so I should say all three, have taken a decrease. So you're paying as low as $2 on some of the plans for your tier 1 medications. Tier 2 also decreased that cost. So rather than paying 20 or 12, depending on the plan that you have now, those will also be going down. So again, a great way to save money. Make sure that you always check out, of course, speak with your doctor to make sure you're on the appropriate type of prescription. And if you can get onto a tier 1 or 2, that certainly will help you, save money going forward. All right, so overall, this is an overview of how the changes to prescription drug copays. So after you get through the first stage where you know you pay either the deductible and the copays or just the copays if you're on tiers 1 or 2, then you would get into what's called the coverage gap stage. So the percentage that you pay when you get into the coverage gap is the 25%, whether it be generic or brand name drugs. You stay in that stage until you spend the $7,050. If you reach that within the calendar year, then you would go into the catastrophic phase, where you either pay the small percentage or the copay, whichever is greater throughout the year. Now, these two stages haven't changed a whole lot from the previous years, but of course the threshold, so the actual amount is what's changed, the $7,050, last year was $6,000. So again, when you're looking at how to plan for the future, just know that these are the changes for these plans as well. Now, for some of you, you may be assigned to a new plan. As I mentioned earlier, we have made sure all of our plans are available throughout the 55 counties, so everyone has the same plan options. And with that, some of those plans we did change. So for those of you who may have been on an Assurance RX plan, we've now put you into the Esteem RX plan. It's still the same $0 premium, and actually your out-of-pocket maximum will be less than it currently is. So it'll only be $5,000. For those of you on the east side of the state and had the Surety RX plan, that also stays the same, $0 premium, putting you into the Esteem plan. And again, your out-of-pocket maximum goes down to $5,000. And those of you on the Promise RX plan, this past year, 2021, will now be putting you into the Essence RX. So the premium does go up slightly to $88, but you'll still enjoy all the great, wonderful benefits of the Essence RX plan. and the out-of-pocket does change as well to $3,400. Again, similar cost structure. And if you decide that you'd like to switch to a different plan, whether it be to the Ascent plan, Steam plan, or the Spirit plan, you certainly may do so. You just have to give us a call and let us know, and we'll assist you with that. All right, now let's talk about our providers. We do have many quality providers locally near you. We, of course, have the Marshfield Clinic Health System. We also have Aspirus. We also have Dickinson County Health System. That's over on the east side of the state. We have Hospital Sisters Health System, Prevea, and Theta Care. We have UW Health, Monroe, Pro Health, and Unity Point Meriter down by the Madison area. Then over on the west side of the state, we still have Prevea Health, Oakleaf Medical, most of those. The Mayo Health System, pardon me, is in network as well. The HSHS system, of course, the Marshfield Clinic throughout the Eau Claire area and all the way up the west part of the state, and St. Luke's Duluth, Memorial Medical, and Essentia Health. So you have quite the variety there of providers to choose from, and they're all high quality providers that are contracted with Security Health Plan. If you're not sure if your provider is part of the network, I encourage you to go onto our webpage, securityhealth.org, or give us a call and we'd be happy to look up your providers for you. But I also want to mention to you, you can stay in network with these providers, or you may be able to go out of network. And you will receive the same coverage, meaning you pay the same copayment at, let's say, Marshfield Clinic as you would at the Cleveland Clinic. As long as the provider accepts Medicare, you have the freedom to go where you choose. This might also be wonderful for those of you who like to winter someplace warm. You don't have to worry about, do I have to check and see if this provider is in network? The question really would be is, do they accept Medicare? And if they do, you can still use that provider for your care. So this is a wonderful service that we provide. Again, it lets you dictate where you go for your health care. And you still would have that zero primary care copay for your office visits. All right, now let's look at all these fun perks that we always offer. Excuse me. The first one is one free annual eye exam. And that includes the refraction to check to see if you need a change in prescriptions. And with that, you can get anywhere from $135 to $175 for eyeglasses, depending on the plan that you have. Make sure with any of these extra perks that you always use in-network providers to receive these extra benefits. Next is the hearing benefit. We do cover your annual hearing exam. You would just pay the specialty office visit copay, and then you can get up to 2 hearing aids per year. A $500 maximum is the most that you could pay on those hearing aids. So that's a wonderful benefit. And then dental care. We do cover 1 free preventive dental cleaning and exam, and either bite wing or panoramic x-ray at no cost to you, which is great because of course oral health is such an important part of your overall health, and we want to make sure that you can go in and get that done at least once a year. Again, make sure that you're using someone in network. We do use our Delta Dental Medicare Advantage network. So if you have a dentist now and you want to know if they take part in Security Health Plan, feel free to ask them, or you can call us, or we do have a link online which shows which dental providers provide Security Health Plan. Then we have our silver sneakers. So this is a really neat program. So if you'd like to go to different facilities, fitness facilities, or work out, or use the treadmill or the track or the pool, you can do so. Or if you want to do some at home, they do have on-demand videos that you can utilize at any point and bring them up on your computer, and you can work out that way as well. And then of course, we can't forget our over-the-counter benefit. So this is a great benefit that we offer every quarter. Each person on our Medicare Advantage plans gets $30 to spend towards those over-the-counter items. So as you know, things like cough drops, acetaminophen, Band-Aids, toothbrushes, things like that that you will be purchasing anyway, now you can get those for free. So make sure that you check each quarter and get your order in. All right, let's talk a little bit more about the dental piece. Now, I mentioned, of course, built into our plans, you do get that one free cleaning each year. But if you'd like additional coverage, you can purchase the supplemental dental. It does cost $43 per month. And what that would provide for you is one additional exam and cleaning. Then if you need emergency pain treatment or fluoride treatment, you would pay 20% of the cost. If you need restorative care, such as crowns, implants, dentures, things like that, you would first have a $100 deductible, then you would pay 50%. The maximum out of pocket on these plans is $1,000, meaning that's the amount that would be paid on your behalf per calendar year. So that's the extra dental coverage. If you're interested in adding that, please give us a call, let us know. We can certainly help you do that. If you currently have that plan and you want to continue on with that extra, great. It'll just continue on into the new year. All right, here's some other extras that we provide. Again, just to keep you healthy and make sure that we're always here for you. We have our free preventive health services. So those are things like your flu shots. We also cover pneumonia. We cover, of course, your annual physical. We also cover colorectal screening exams, colonoscopies. Those do not have any copay. Those are all part of your benefits. Now, if you would like to get your prescriptions mailed directly to your home, we do have that available as well. You just let us know, contact our pharmacy department, and we'll make sure we get that set up for you. Should you have a health question, we do have our nurse line available 24/7, and they can assess whether or not that's something that they can assist with. And there may be a situation where then you could use our Care My Way service, which costs nothing for you. Care My Way is where you can actually speak with one of our nurses and they can talk through different symptoms you're having to see if possibly that's something they can assist you with and even send a prescription to the pharmacy, which saves you time so you don't have to go in and see a doctor. And overall, we're just trying to help you stay healthy. We have other programs as well, healthy hearts, diabetes management. Again, these are always available to you at no cost. So that wraps up our Medicare Advantage HMO plans. Now, for those of you who are on our Ally plan, we'll talk a little bit about that. Not a whole lot of change, but we do want to touch on it. Our Ally RX plan, for those of you who may not know, is our special needs plan. What that means is you have to be on both Medicare and Medicaid in order to be on the Ally RX plan. Also, you must live within the 12 counties that we provide this plan in. So you can see on the map here, those yellow shaded counties is where you would need to reside. This is a $0 monthly premium plan. What's really great is it helps you make sure that you're getting all the care that you need. We have registered nurses and social workers, a whole support team that will make sure that all your services are being coordinated on your behalf. So your doctors and your nurses are talking to your care team at Security Health Plan, again, making sure you have everything you need. You still get all those wonderful extras, the hearing, the vision, and the preventive dental benefits. And if you want, you can add on that optional supplemental dental for only $34 a month. You also get the silver sneakers and the over-the-counter benefit that I mentioned earlier. And again, there's zero premium to this plan. Now let's talk about our Secure Saver plan. That is our Medicare Medical Savings Account plan, or MSA as we call it. There's been no change to this plan. So if you're currently on this plan, there's nothing new to the plan, which is great. It means we're keeping everything stable. For those of you who are checking out all your plan options, the way that this plan works is it's a high deductible health plan. So this coming year, it's $5,600, but it's combined with a savings account. So what that means is once you become a member, a dollar amount is put into a savings account through Optum Bank. You will receive a debit card from them that you can use to pay for your health care. And this year we're depositing $1,920. So that's your money to use for your health care. As long as you use that money for Medicare qualified services, that will go toward the deductible. And should you reach the amount of $1,920 towards your deductible, then you would just have the $3,680 left. If you should reach that and pay that out to your providers, then Security Health Plan takes over paying the rest of the calendar year. Now, if you do not use up the entire amount that's deposited, that does roll over to the next year. So that's your money to keep going forward. So again, this plan also is a 0 monthly premium. And as long as you're on the plan, there's also no monthly maintenance fees to have that plan. You have the flexibility to choose your provider throughout the United States. Again, just make sure they're a Medicare participating provider. You still get all the extra help to keep you staying healthy, the 24-hour nurse line in the Care My Way. And again, that money stays with you year after year, so you can grow that account. So that's our Secure Saver plan. Now, switching is very easy. You can either call us, you can go online, or you can visit with your agent or broker, the person that first helped you get enrolled. Any way that you do that, we're here to help you. So let us know. Of course, the annual enrollment period does go until December 7th. So if you would like to make a plan change, feel free to do that, and we'll be able to assist you, and that change will be effective the 1st of January. If you missed the time frame, say it's after the 7th and you just saw this video or you thought about giving us a call, please still do so, because we do have other enrollment opportunities. We certainly want to make sure that we're here to help. Discrimination is against the law, and of course, Security Health Plan does comply with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, religion, disability, age, sex, gender identity, sexual orientation, or health status. If you do need alternative forms of communication, let us know. We can certainly get that out to you if you need large print or some other type of documentation for your needs. All right, again, we're here to help you. If you have questions, let us know. We can certainly answer those for you. You can go onto our webpage, securityhealth.org/Medicare22. You can also log into your My Security Health Plan. We have a chat feature. We'll speak with a customer service representative, or you can call us. The number is 866-242-1135. Or again, feel free to reach out to your licensed Security Health Plan broker, and they'll be able to assist you as well. Thank you very much for watching this video. Again, if you need anything, let us know. Thank you.